Hi, my name's Ryan Nichit. I'm one of the surgery physician assistants on the pediatric surgery team. You and your baby have made it through the operation for pyloric stenosis, and now it's time to go home. The purpose of this video is to go over the instructions for caring for your baby once you're at home. Don't worry, this video is not the only instructions that you will receive before going home. We have written instructions that you can take home too, and a member of our staff will go over them with you. But in case you forgot what I said during this video, it will be written down for you. And if you want to review this video again, even after you go home, you'll be able to find it on All Children's Hospital website at www.allkids.org/surgery. First, let's go over the care of the surgical wound. Sometimes your baby's bandage will be removed while you're still in the hospital, but if it's still on when you leave, make certain you remove it 2 days after. Taking off the dressing is not difficult. Just peel up the edges of the adhesive bandage and gently remove it. Underneath the bandage, there may be some steri-strips. These look like little pieces of tape. Don't take these off. The steri-strips remain on to give the incision extra strength and protection while it heals. Do not remove the steri-strips when taking off the bandage. The steri-strips will fall off on their own in about 2 weeks. Just treat them as if they are regular skin. They can get wet and you don't need to put a new bandage on top of them. When you first take off the dressing, you may notice a little redness from where the bandage was sticking onto the skin. This is normal. There might also be some puffiness or some black and blue around the incision. This can also happen sometimes. In addition, the steri-strips might have some dried blood on them. That's okay too. What is not okay is if you see active bleeding, spreading redness around the incision, or pus drainage from the wound. If this happens, make sure to call us. For the first week after the operation, your baby can only have a sponge bath. Only after a week after the incision has healed well enough that your baby can soak underwater in a bathtub or in a swimming pool. Now let's talk about pain. It is normal to have some pain after an operation. Your baby was given medicine in the hospital to minimize this pain and may still need medication after going home. Let me review a couple of the common medicines we recommend. But remember, every baby is different and some kids may have allergies or reactions to medicines. So during the discharge process, we'll go over which medicines are okay for your child. Acetaminophen, commonly known as Tylenol, or ibuprofen, commonly known as Motrin, are both over-the-counter medicines that are very effective for treatment of pain after an operation. These are the most common pain medicines that we recommend. You should follow the dosing guidelines on the bottle. For babies with pyloric stenosis, we typically don't need to give any prescription pain medicines. Your baby may need to take other medicines after you go home. For example, some patients may need to be on antibiotics, or you may have questions about when to resume any other medicines that your baby takes regularly. We'll review this with you on a case-to-case basis. After you leave the hospital, there will not be any restrictions on your baby's activity. Your baby should feed normally, but remember, your baby may still spit up now and then. A little vomit does not mean that the operation did not work, since all babies may have wet burps or some minor spit-ups. However, there are several warning signs that you need to be aware of. Fever greater than 101, nausea or vomiting that persists after 12 hours, bleeding, some blood on the bandage is okay, pus from the wound, spreading redness around the wound, or worsening pain. If you have any questions about these warning signs, or if you have any other concerns, feel free to call us. We always have a pediatric surgery nurse practitioner or physician assistant working 24 hours a day, 7 days a week. If they can't take your call right away, we'll call you back within the hour. There is also a pediatric surgeon on call all the time if it turns out to be something serious. Obviously, if you have a true medical emergency, you should call 911. The last thing I'll cover is the follow-up visit. We generally like to see you back in 2 weeks after you leave the hospital. There is no extra charge for this visit. The purpose is for us to check and make certain everything is okay, and to share any late arriving test results with you. Our offices are based here at All Children's Hospital and the Outpatient Care Center across the street from the hospital. However, we also hold office hours at some of our All Children's outreach centers. Once you get home, call our office and talk to our staff. They will help you schedule an appointment at the time and location that is most convenient for you. We're glad that you're ready to go home. This video was meant to give you some useful information. If you forget anything that I covered, you can watch it again at home on the internet. Just go to our website and we'll see you in a couple of weeks at your follow-up visit.